Night Sweats Decoded, Understanding Causes, Triggers, and Relief Strategies for Chronic Sweaters. Night sweats, also known as nocturnal hyperhidrosis, are episodes of excessive sweating during sleep that often leave individuals drenched in sweat despite sleeping in cool conditions. While occasional night sweats may be harmless, frequent occurrences can signal underlying health concerns ranging from infections to hormonal imbalances. For members of the always sweating community, night sweats can feel particularly frustrating due to heightened sensitivity to body temperature regulation challenges. This guide explores the science behind night sweats, potential root causes, lifestyle interventions, and when to seek medical attention. The science behind night sweats: what happens during sleep? During normal sleep cycles, the body undergoes several physiological changes, including fluctuations in core temperature, heart rate, and hormone levels. These natural processes typically regulate body heat efficiently, preventing excessive perspiration. However, disruptions in any of these systems can lead to abnormal sweating patterns. Hormonal shifts: cortisol and melatonin levels change significantly during different stages of sleep, influencing metabolism and thermoregulation. Imbalances in thyroid hormones or sex hormones can disrupt this delicate equilibrium. Sleep disorders: conditions like sleep apnea trigger repeated awakenings and increased sympathetic nervous system activity, both of which elevate body temperature and stimulate sweat glands. Blood sugar management: insulin resistance or diabetes-related hypoglycemia events occurring overnight can initiate compensatory mechanisms involving sweat production. Thermoregulatory responses: when core body temperature rises above normal thresholds, typically around 98.6 degrees Fahrenheit per 37 degrees Celsius, the hypothalamus activates sweat glands to dissipate excess heat through evaporation. Autonomic nervous system activity: increased parasympathetic tone during REM sleep phases promotes glandular secretion, while heightened sympathetic activation from stressors can produce similar effects. Common medical causes of persistent night sweats: persistent night sweats lasting weeks or months often indicate an underlying medical condition requiring evaluation. Infectious diseases remain among the most prevalent culprits affecting individuals across various age groups. Tuberculosis: a classic presentation includes chills, fevers, and profuse night sweats that persist even after other symptoms subside. Pulmonary involvement is typical, though extrapulmonary forms exist. Fungal infections: histoplasmosis, coccidioidomycosis, and blastomycosis all exhibit characteristic triads combining fever, cough, and excessive nighttime perspiration. Diagnosis requires specialized serological testing. Cancer associations: lymphomas, leukemias, and metastatic malignancies frequently present with constitutional symptoms including unintentional weight loss and diaphoresis during sleep. Hodgkin's disease shows particular affinity for night sweating manifestations. HIV/AIDS progression: early stages of human immunodeficiency virus infection commonly involve flu-like prodromes accompanied by significant nocturnal hyperhidrosis. Monitoring CD4 counts becomes crucial during diagnostic workups. Malignant tumors, solid organ neoplasms, especially those with high metabolic demands or local inflammatory infiltrates, may provoke systemic responses leading to evening sweat episodes. Non-medical factors contributing to excessive nighttime perspiration: while clinical diagnoses account for many cases, environmental influences and behavioral patterns play substantial roles in modulating nocturnal sweating intensity. Identifying personal risk factors enables targeted intervention strategies. Lifestyle choices: consumption of stimulants like caffeine, nicotine, and certain pharmaceutical agents can elevate basal metabolic rates, increasing thermal output and subsequent sweating requirements. Dietary impacts: spicy foods containing capsaicin activate TRPV1 receptors in eccrine glands, triggering localized perspiration reactions that sometimes manifest prominently during rest periods. Bedding materials: synthetic fabrics trap moisture against skin surfaces rather than allowing evaporative cooling. Choosing breathable cotton linens improves air circulation and reduces occlusive pressure on sweat ducts. Room environment: ambient temperatures above 75 degrees Fahrenheit 24 degrees Celsius create uncomfortable microclimates conducive to perspiration. Using programmable thermostats ensures optimal sleep climate control. Alcohol intake. Ethanol acts as vasodilator, promoting blood flow redistribution toward peripheral tissues. Combined with central nervous system depression, this increases likelihood of nighttime sweating episodes. Strategies for managing night sweats through lifestyle adjustments. Implementing simple modifications to daily routines offers effective relief for mild to moderate night sweats without pharmacological intervention. Prioritizing sleep hygiene establishes foundational improvements in overall thermoregulatory function. Consistent bedtime schedules. Maintaining fixed wake/sleep times reinforces circadian rhythm stability, optimizing hypothalamic pituitary adrenal axis functionality critical for temperature regulation. Stress reduction techniques, mindfulness meditation, progressive muscle relaxation, and guided imagery decrease cortisol levels, mitigating autonomic hyperactivity that contributes to excessive sweating. Avoidance of pre-bed stimuli. Limiting screen exposure 2 hours prior to sleep minimizes blue light suppression of melatonin synthesis, improving quality of rest and reducing nocturnal hyperthermia risks. Appropriate sleep attire. Wearing lightweight, absorbent pajamas made from natural fibers allows free movement of moisture away from skin surface, preventing secondary irritation and bacterial growth. Humidifier use. Introducing controlled humidity levels prevents dry air from stimulating eccrine glands unnecessarily, balancing evaporative cooling efficiency with comfort. Dietary considerations for reducing nocturnal hyperhidrosis. Nutritional choices exert direct influence over sweat production through biochemical pathways regulating body temperature homeostasis. Strategic meal timing and ingredient selection optimize nocturnal comfort levels. Hydration balance. Proper fluid intake maintains electrolyte equilibrium essential for normal sweat composition. Dehydration concentrates minerals in sweat, potentially irritating skin and intensifying perception of wetness. Glycemic control. Consuming low glycemic index carbohydrates stabilizes insulin release patterns, minimizing glucose spikes that could theoretically trigger compensatory sweating mechanisms. Vitamin supplementation. Deficiencies in vitamin D, B-complex vitamins, and magnesium have been linked to dysregulated autonomic nervous system functioning. Consulting healthcare providers before initiating supplements remains prudent. Eat late-night snacks wisely. Light protein-rich options like Greek yogurt or almonds provide sustained energy without provoking digestive distress that might interfere with restful sleep. Herbal remedies. Traditional Chinese medicine practitioners recommend astragalus root and licorice extract for supporting immune function and reducing pathological sweating tendencies. Medical evaluation protocols for recurrent night sweats. When lifestyle interventions fail to alleviate persistent night sweats, comprehensive medical assessment becomes imperative. Primary care physicians serve as initial gatekeepers, coordinating referrals to specialty services when indicated. Initial screening. Routine CBC, ESR, CRP tests detect signs of inflammation or infection. Urinalysis screens for glucosuria, suggesting undiagnosed diabetes mellitus as contributing factor. Imaging studies. Chest X-rays identify pulmonary abnormalities associated with tuberculosis or fungal infections. CT scans evaluate mediastinal lymphadenopathy suspicious for lymphomas. Specialist consultations, endocrinology evaluations. Assess thyroid dysfunction using TSH/T4 panels. Oncology referrals consider staging investigations for suspected hematologic malignancies. Biopsy procedures, bone marrow aspirations or lymph node excisions obtain definitive tissue diagnosis when imaging findings remain inconclusive regarding neoplasm presence. Autoimmune panel testing. ANA titers, RF levels, and complement component measurements aid in diagnosing rheumatologic conditions presenting with constitutional symptoms. Pharmacological options for treating chronic night sweats. Medication-based approaches offer therapeutic alternatives when conservative measures prove insufficient. Selecting appropriate pharmacotherapy depends upon underlying pathology identification through thorough diagnostic workup. Anticholinergic drugs, glycopyrrolate and oxybutynin inhibit acetylcholine receptor activation, decreasing sweat gland stimulation. Side effects include urinary retention and cognitive impairment requiring careful monitoring. Tranquilizers, low-dose benzodiazepines like lorazepam manage anxiety-induced night sweats effectively but carry dependency risks necessitating periodic reassessment. Hormone replacement therapy. Menopausal women receiving estrogen/progestin combinations often experience reduced hot flashes and associated nocturnal sweating episodes. Chemotherapy regimens. For cancer patients undergoing treatment, antiemetics like ondansetron address chemotherapy-induced sweating while preserving efficacy of primary anti-cancer therapies. Botulinum toxin injections. Localized treatments targeting axillary regions reduce eccrine gland activity temporarily, providing relief for focal hyperhidrosis manifestations. Psychological aspects of living with chronic night sweats. The psychological burden accompanying recurrent night sweats extends beyond physical discomfort, impacting emotional well-being and social interactions. Addressing mental health components complements biomedical management strategies. Anxiety perpetuation cycle. Fear of waking up soaked in sweat creates anticipatory anxiety that paradoxically worsens symptomatology through neuroendocrine activation. Quality of life implications. Disrupted sleep architecture leads to daytime fatigue, impaired concentration, and diminished productivity affecting professional performance and interpersonal relationships. Coping mechanism development. Establishing nightly rituals reinforcing sense of control helps mitigate perceived threat value of night sweats, fostering adaptive resilience over time. Social support networks. Connecting with others sharing similar experiences provides validation and practical coping strategy exchanges, enhancing individual adjustment capacities. Cognitive behavioral therapy. Targeted CBT protocols modify maladaptive thought patterns surrounding night sweats, reducing subjective distress related to this condition. Emerging therapies and research frontiers. Ongoing scientific inquiry continues exploring novel avenues for treating refractory night sweats, leveraging advances in molecular biology and digital health technologies. Genomic profiling. Investigating genetic polymorphisms linked to altered thermoregulatory setpoints identifies potential biomarkers guiding personalized treatment decisions. Wearable biosensors. Smart devices continuously monitor core body temperature, heart rate variability, and galvanic skin response to predict impending sweating episodes preemptively. Neuromodulation techniques. Vagus nerve stimulation trials show promise in modulating autonomic outflow responsible for excessive sweating manifestations. Topical formulations. Development of selective ion channel blockers targeting sweat glands aims to achieve localized inhibition without systemic side effect profiles. Telemedicine platforms. Virtual consultation models enable remote patient monitoring and real-time symptom tracking, facilitating timely clinical interventions. Conclusion. Nocturnal hyperhidrosis represents complex interplay between physiological regulatory mechanisms and external environmental influences. Effective management requires multifaceted approach integrating lifestyle adaptations, medical investigation, and supportive care elements tailored to individual circumstances. By adopting systematic evaluation frameworks and implementing evidence-based solutions, sufferers can reclaim control over their sleep environments while addressing underlying pathophysiological contributors. Proactive engagement with healthcare professionals remains vital for ensuring long-term wellness outcomes aligned with personal goals and expectations.